that's really where you're going to see people avoiding. So what are some everyday examples that we can bring this home? Maybe, and hopefully this does turn into a discussion, and I know it's not easy to talk in front of people you don't know. If anyone wants to venture, we can give it a shot. So, example of horses, social situations. You imagine being in a social situation, you've been in social situations and you don't feel good. You feel nervous, you feel tongue-tied, you feel stupid, on and on and on and on and on. Okay. So, you tried it a few times, in your estimation hasn't gone well, so when we come later on, just don't go. Hey John, you want to go to the party? It's going to be great. So-and-so is going to be there. She wants to meet you. Oh no, I really, kind of tired, long work week. Hey, but thanks. Yeah, definitely catch me on the next one. Hang up. I'm going to feel embarrassed. Okay. Rejection. You said no to. Stop asking for things. Don't ask for raises. Don't ask for dates. Don't ask your loved one, hey, could you not talk to me that way? Or would you mind picking me up at this time and not that time? Because one time someone said, heck no! And we don't like it. Maybe two, maybe three, maybe thousands. So stop asking for things. I don't get what I want, but I don't feel that rejected feeling. Getting sick. Very common form of obsessive compulsive disorder, OCD, fear of contamination, germs, or cancer. It's the big one in terms of germs. People wash their hands, and I'm not talking 10 times a day. I'm not talking 20. I'm talking washing them to the point where they're bleeding. People will do that because it is the thought of getting sick and all the things that come along with it brings so much angst. People literally hurt themselves to make it go away. Or another one might be you feel a little lump in your throat, a cough or something, boom, you get an MRI. Because, or whatever, you call your doctor, can I get in? Can you just look down? Are you sure? Can you check the way back right corner? Because a day ago it wasn't there. Yeah, and then you go, and then for a little while you feel better. Okay. Making mistakes. If you've been in graduate school or any kind of achievement-oriented program or work, and almost I could describe just about every job there is out there, fear of making mistakes. Big. To the point where people were, let's see, one thing, we check their work over and over and over again. Have clients that will reread and reread emails for hours before they'll hit send. Talking a few sentences. I worded it right. I worded it in such a way that, well, if I got all my punctuation right, if I take into account for everybody else's perspective, I don't want to look stupid, whatever it is. Whatever it is, check your work, check your work. And then, of course, you do that enough, you're not doing your work. And, that's creates, our solutions tend to create a whole other set of problems. And what we see at this clinic all the time, who experiences pain on a daily basis?
I didn't hear you.
Who experiences pain on a daily basis? Okay. And, okay, we know no one likes that experience. And that's normal. How much does one worry about that? This pain means I just did some damage. Not that, oh, there's my back again, or there's my elbow, or there's my knee, but, oh, that means I've done structural damage. And oh my goodness. So that re-injury piece. And then people get less and less active. Even the stuff they love to do. And this is why you see anxiety and depression go so hand in hand, is when you're anxious because something matters to you. And odds are you're going to figure out a way to not feel anxious. It means you're going to do less of the thing that some way matters to you. And when you do, you're not in contact with things that you like to do, make you feel good, long enough, hello depression. It's normal. It's not a disorder. It is a regular process, using our rational minds to solve the wrong kind of problem, which is something that's going on inside our bodies. So here's something else you got to remember. It's not the horse that I'm so scared of. It's feeling that way. That feeling that is the worst thing in my experience, professionally and personally, it's the worst thing to feel. I don't care what does it. It's not that, it's that. I don't want to feel that. You know what this treatment does? It teaches you, oh, scared? I'm not going to die. I can handle it. I have control over whatever's going to happen. Okay, I might fall off and I might get hurt or whatever it is, but life's going to go on. It's not stopping me. I don't have the ability to remove fear. I can help things get neutral again and help people get back on into their life. And I do it every day. But I don't say you'll feel no fear, because that would make you one of those 2% that it sounds nice, but it's not where people live. The whole point of what I do is to get people back into their lives. And if you do enough of this, whatever it is that turns you on, that makes you feel alive, that makes you feel fulfilled, whatever that is, if you're doing a lot of this, you're teaching yourself that, screw this. I'm doing this. And eventually you're teaching yourself, I can take it. And then all this other stuff goes away. It just does. I think that's the end of the official part of the presentation. But again, if there's any questions I want to bring up here, love to hear them. Everybody could learn. Or I will stick around and talk to you if you'd like. Also, Molly's here, and if you wanted to have I offer a chance to have a free consultation, and it's totally confidential. You know, we get to meet, and you can tell me what's going on. I can give you my thoughts, and things that way. So, there are your 3 options, folks. Also, leaving and doing nothing. That's, I guess, the other option. Or you could skip out of here, or you could shuffle. Yeah, there's all lots of
like that option.
The 3 that I would be involved in. Anyway.
Are you going to do any more on stress, handling stress?
Handling stress?
That sort of thing?
Absolutely.
I missed the first 3 or 2 sessions that you had.
Yeah.